I'm the CEO of Untapped AI, and we are a coaching company, digital coaching, and it's powered by AI. We use AI to speed up behavioural change for the individuals we work with and for the organisations we work with. And we work with big corporates across 43 cities in the world, and the main topics we work with people on is leadership, well-being, and diversity. But today we're going to very much focus on the topic of burnout. And I'd really like to invite my two colleagues, Brendan O'Hara, who is my co-founder and the MD of Untapped AI, and Karen Evans, who is the Chief Product Officer and our thought leader in Untapped AI. So welcome, both of you. Brendan, I very much wanted to be here because not only is he the co-founder of Untapped AI, but he's a technologist, but has actually worked for nearly 20 years working from home from Ireland. Let me start with a statistic. So I want to tell you that on our platform at the moment, I'm just seeing if I can, yes, there we go. On our platform at the moment, we are finding at the end of May that 27% of people are in the pre-burnout phase. And we're finding this is actually increasing as the months go on. So I'd really like to start, Karen, with the biggest question is, what is pre-burnout for, and how do you define it for individuals, but also for organisations?
Okay, so since I think 1971, there's been ways of assessing burnout in individuals, and I think that what we've been thinking about is how can we help people and organisations to intervene in the pre-burnout stage. So pre-burnout stage is usually identified by people feeling a sense of overwhelm. I mean, obviously we're in COVID-19, and I imagine the repercussions from that will continue for some time, and that will add to people's sense of being overwhelmed. But the key fact is people feeling overwhelmed. What we hear from our platform is people using phrases like, I feel like I'm doing two jobs, I dread going into work, I will never be able to finish, I'm never able to finish my to-do list, those kinds of things. And we are looking at overwhelm as being that key place where you can make an intervention to help people to stop people from spiraling down into full-blown burnout.
And what about organisations, Karen? How can they tell that they've got a lot of pre-burnout or burnout?
Well, I think that a standard way of doing that would be to do assessments or to do surveys, questionnaires. I think that what we have found is that some of those tools are not as reliable as they might be, because people are often confused about why and how they're feeling overwhelmed. I suppose the thing that I didn't add was, it's not just feeling overwhelmed, perhaps for a day or a couple of hours. We're talking about people in pre-burnout feel overwhelmed most of the time. I'm sorry, Kendall, you have to repeat the question. I've just gone off.
Organisations in a culture, what would the culture, I suppose my question is, what's the culture feel like when you've got a lot of people in pre-burnout? How would it feel? What's that culture?
Okay, that's a bit clearer. Okay, I think generally pre-burnout and burnout is present in anxious organisations, and currently most organisations are in anxious states because of some of the things I've said previously. I think the anxiety itself in an organization is a response to the uncertainty. And there is a kind of contraction that goes on when an organization is in an anxious state. I think things that predispose pre-burnout are a critical culture, a culture where there's not a great deal of notice or feedback that's given or taken. I think a blaming culture, a culture that cultivates the idea of making people who are working very hard feel very anxious about the value of what they're offering. So those kinds of things contribute. An unthinking culture, a culture where people don't notice, don't notice what's happening to the people around them. And I think that has implications as well for the fact that many more people are going to be working from home. So who in an organisation will notice that? There may be some difficulties.
I'm going to move on now, Karen, to how do we measure on our platform burnout, pre-burnout? What are the different ways that we collect the data? If you could share that.
Okay. Well, I suppose partly in order to get a sense of how the different data streams fit together, we would use surveys, we would use self-reported surveys, and I think that there is some difficulty using self-reported surveys because people have all sorts of relationships to those surveys, particularly if they are sent out by their organisation, and I'm not sure how truthful people feel able to be on those surveys. Certainly our experience has shown that there's a fairly substantial discrepancy between data collected around burnout through surveys like the Generalised Anxiety and Disorder, the PHQ-9, the depression scale, well-being surveys, those kinds of things, and resilience surveys. What we're interested in looking at is looking at passively collected data. So data from people's conversations with our digital coaches, things that they have written, and we run an AI algorithm through that picks up certain characteristics that are indicative of the pre-burnout, the overwhelm state, or full burnout, which includes a sense of ineffectiveness, a sense of detachment, and a number of other subsets there. So I think that, yeah.
And we're able to predict now 6 months, burnout 6 months before it happens.
We're able to identify people in the overwhelmed state where an intervention would be most useful. And I suppose an intervention sounds quite clinical. What I mean is just some help would be quite useful at that stage. And yeah, and I think if people descend into full burnout, it's much more difficult to help them to overcome that. I think a great many valuable people are lost at that point. There's prolonged sick leave, and I guess people don't want to experience the feelings that they experienced in burnout again, so they often leave. But yes, we are able to tell. We were able to make we're able to tell about 6 months before people would ordinarily descend into full burnout. Yeah.
So I'd like to move across to Brendan now, and you've had nearly 20 years, Brendan, working from home in Ireland. Now we're all working from home. Why is working from home exacerbating pre-burnout?
So yes, I started working from home 17 years ago. I used to work in the city in London, and I moved to the south coast of Ireland. I pioneered it really, and I went through the whole idea that I needed to compensate the privilege of working from home by working longer hours in an industry that already works for really long hours. And so I worked long hours, and eventually I got to a state where I was quite overwhelmed. But I chose to work from home, and I created my own office, and I segregated my work life from my family life. In the last 3 months, an awful lot of people are working from home, not by choice, and they haven't set themselves up an office, and they haven't segregated their family life from their work life. So people like that, who don't feel like they're having to compensate the privilege, don't feel it as a privilege, they have to be seen to be productive, and so probably end up working even longer hours, working early in the morning or late at night when the disruptions aren't there, and probably catching up at weekends. This is causing a massive pressure cooker of people who are going to feel overwhelmed, and that overwhelm is going to then lead to burnout. So the question I would like to leave you with is, what information do leaders have that their people are actually not feeling overwhelmed at the moment, or how overwhelmed? It is really difficult to know this at the moment, because they're all working from home. You only see them on Zoom calls or on video calls. What information can you go by to know how well your people are coping?
It's such a good question, Brendan. It's so difficult for leaders right now because, as you say, they're managing remotely, but also they can't pick up on any cues, and the individuals don't have the opportunity to share. So I'd like to take it to how it makes it an even more important issue. We're working at home, but also that it's now burnout is classified as a disease. So can you tell us more about that?
Yeah, but the risk now is that large or companies in general might think, well, look, we will, everyone's in this together. There will be a certain fallout from this, and we'll cope with it, once we get back to normality, whatever that might look like. But on May 2019, the World Health Organization classified burnout as a workplace disease, which means that employers are responsible for people who get burnt out, and they have to take notes. They have to actually provide people with the necessary help to help them through that. But getting to burnout is too late, because when you've got to burnout, it's very costly to get someone out of burnout, and majority of the time people will leave because they will downsize. They will not want to get into burnout again. So ideally, you want people to go. You want to sort it at pre-burnout stage, which is what we're trying to work out now. Is we're able to get the data to show pre-burnout, and we can get that before it happens.
Okay, well, let's move back to Karen, and really like to finish off now. So I suppose a really important question for individuals watching that might be feeling that this is definitely where I'm at right now, but also people representing organisations as to what can you do. So I'd like to ask you those two questions really, Karen. What can we as individuals do? And secondly, what can organisations do right now?
Well, I think probably the key thing for individuals is to notice their feelings as they're emerging. We're in a time, because of COVID-19 and all the attendant difficulties, crises that are happening, where feelings are very much to the forefront. So notice those feelings. Notice that you've been feeling tired, unwell, overwhelmed, short-tempered, frustrated. Notice those feelings, and if they continue for more than a couple of days, if that dread about starting your work continues for more than a couple of days, it's really worth taking the risk to have a conversation with someone that you trust about how you're feeling, and maybe asking them how, and it doesn't have to be a work colleague. I think it can be needs to be someone you trust. And I guess just having conversations with them about how they're experiencing you. And then if it becomes clear that you are feeling overwhelmed, I think the next step is to actually try to think about what might you do about that, because it won't go away by itself. That's very clear. And it may take you further down the burnout route, which is, you know, I know from personal experience, definitely a place you don't want to be, and it takes you a long time to recover. So I would seek at that point interventions. I think an organisation has a very real responsibility now to offer support to people, to offer non-stigmatised, confidential support to people who are experiencing pre-burnout, who are experiencing the overwhelm, are struggling to manage their workload, struggling to achieve a mindset where things feel possible. I think that's a key point where organisations can offer the kinds of services that can help people get themselves back onto track. I think it might be that organisations at this point can offer breaks or different working hours. I think organisations, I know organisations are working very hard to develop positive and helpful mental health strategies. I think it's keep doing that work, keep publicising that work, keep being aware that people find mental health issues very difficult to talk about, provide the circumstances in which they can do that. And the other thing, which I think is probably key to what we do, is, I suppose, the question: how do you know that where your people are on the burnout continuum? And I suppose that what we've been doing is, you know, where is your good data? Where can you formulate policies that actually fit what's happening in your organisation? And I think what's become apparent to us as we've been working with pre-burnout and burnout is that people often underestimate or overestimate where they are on that continuum. And I think to use passively collected data is one way in which you can get a very real and I suppose unpolluted idea of where your people are actually at. And, you know, do you have a large contingent of pre-burnout people in one particular section? I'm sorry, I'm just conscious of time.
Well, thank you both. I'm going to stop sharing. Yes, we'd like to, if there are any questions, answer them now. I think there's a question to all: how would you avoid burnout? There's a good one here. How do you ensure you keep home life and work life separate when you're working and living in the same space? That's a brilliant one, because Brendan's got 6 children and I've got 5, so I can tell you it's an ongoing, impossible task. But I think, Karen, we get this question all the time, so I'm going to throw that one to you. What's your...
We do. I mean, I think this is something. So when Brendan talks about his experience, there was lots of preparation for working from home and carving up spaces and you know, sort of understanding what it meant. I think lots of people were thrown into working from home. I think it's about experimenting and establishing boundaries. Working from home is not going to be like working from an office. I don't think you can underestimate the value of a good door that separates you from the rest of whatever's going on in your house. I mean, it won't stop interruptions, but it will certainly slow them down. I think it's about difficult conversations with people about how to share the space, and I think it is about staking a claim for a certain amount of uninterrupted time and negotiating. And of course, those negotiations will fail, but they need to be rebuilt. And actually, I'm confident if you work with setting boundaries, then actually you will find a way and pace of working from home that suits you.
Setting of boundaries is one of the biggest things that we're helping people with. And it's ongoing, as Karen said, and changing. And many people not saying they're working from home, is they're at home working. I've got one last question so we can finish off. I'm going to put this to Brendan. What is the number one takeaway to see moving forward in terms of aggregating data to be dealing with a global crisis?
Well, I think, we currently are detecting pre-burnout. I think pre-burnout should be recognized. I think it should be recognized as the precursor to burnout, and therefore needs to be well measured. I think aggregating that sort of data and defining it as the symptoms of the disease is really important. I think that's what I would say.
On that note, thank you, everybody.
Want access to more CogX videos? Subscribe now for free at cogx.co.